Good evening. This is Dr.Sudarsan Ray Psychiatrist. Once again, bringing to you the latest in the series of how to deal with various mental health problems during this COVID-19 lockdown period. Basically, you see, in case of addiction, what to do? I mean, how do we deal with addictive problems during this COVID-19 lockdown period? Now, one thing this COVID-19 lockdown period has achieved is that due to the closure of the liquor shops, basically, clients, the patients who have had difficulty in abstaining themselves from alcohol or even nicotine, they were forced to do so. I mean, they were forced to inculcate in themselves the self-discipline, which is very much required for getting rid of this addiction. Now, if you're talking about this addiction management, the general guidelines is that you see the patient has to be given the feedback. I mean, the patient should get the feedback as to what are the risks, the negative effects, and the dangerous effects of this using these substances, the substance use disorder (SUD) or alcohol use disorder (AUD). Okay, then you should actually explain. The patient should understand that he is the only person actually who is responsible for this addiction, and it is his responsibility or her responsibility to come out of it. I mean, a psychiatrist and a psychologist and the medications will actually help him or her, but he or she has to assume responsibility for his or her actions and also take the appropriate remedial measures and come out of it. Okay, now when we are giving advices, we give very straightforward advice that you have to transform your behavior, you have to modify your drug use. Okay, now there are various menu of options which you can make available to the patient. Okay, now whatever happens, the menu of options actually it will be tailor made for the patient, for the client. I mean, he will actually explore the menu of options which are available to him, so that he can get rid of this addiction. But at the same time, obviously, we mental health professionals empathize with the patient, and we empathize with him or her and say that yes, you are suffering from a real problem, and we do understand your pain, but then you have got to heal yourself. We can merely sort of guide you, and the medications will sort of provide you with a sort of support, but unless you decide to take responsibility and move ahead, you decide the menu of options available, you realize that yes, it is harmful, and you listen to our advice, and of course you have to apply the advice in your own life. You yourself have to do it. You cannot be spoon fed. Then only you can get rid of addiction. Now, as far as this alcohol addiction is concerned, this alcohol use disorder (AUD), basically, you see, I mean, similarities have been found with the nicotine use disorder also. Okay, NUD, so similarities are there. I mean, these agents actually they activate the reward mechanism in our brain. I mean, I'm speaking in layman's terms so that you can understand. So this gratification, this reward mechanism, activation of reward mechanism has to be interrupted, and for that we may use aversion agents like disulfiram and anti-craving agents also, like this naltrexone, baclofen, aripiprazole. Various agents are there, but you see, I mean, only pharmacotherapy cannot actually help you get rid of this alcohol addiction or nicotine addiction. They are, it is very common that while this treatment is taking place, it is in almost 70% of cases, the incidences of lapses are there, and then there are the incidences of relapses. Okay, people going in and out of the rehab centers. Now, I'm not going into the plus and minus points of the rehab centers, but lapse and relapse are very much common. And you see, while you taking these medications, I mean, you have to basically try and abstain yourself totally from alcohol or from nicotine, because these agents, I mean, for example, the aversion agents, they produce a very unpleasant reaction, the ethanol reaction, due to accumulation of acetaldehyde and so very unpleasant feeling. I mean, whenever you ingest alcohol, you break the discipline, and you actually face these problems like nausea and severe flushes, hypertension. But this can even result in death. So why go towards that? Okay. Now we can also prescribe anti-craving agents, but anti-craving agents won't cure you. I mean, as I said, that you have to cure yourself. Self-motivation is the key. Now, while taking anti-craving agents, I mean, if you do not actually reduce your alcohol intake and ultimately stop it, even the anti-craving agents are doomed for failure. And almost all of these agents, they are very expensive. They are very expensive and difficult to sustain also. And you see, they all have effects on your liver or on your kidney or even on your eye. And so you have to be very careful. Fact is that while motivating yourself, you just remember one thing, that empty mind is the devil's workshop. So try and keep yourself engaged. You try and keep yourself engaged. And even during this COVID lockdown period, as I said that in earlier videos, I've said that you talk to the relative or the friend you have not spoken to for a pretty long time, talk over the phone, not chat over WhatsApp or Facebook or SMS. You read the novel which you have not read for a pretty long time. You listen to the music, the record which you could not play for a pretty long time because of work pressure. And of course, you admit to your friends, to your near and dear ones, that yes, you have a problem, and that you are suffering from sadness, this melancholia, depression. You are suffering from anxiety. Do not deny your problems. Practice mindfulness. Practice this abstinence from addictive substances. And as I said that you have to take responsibility for your own addiction, for your own cure, and then only the therapy, pharmacotherapy, psychotherapy will be successful. Thank you. Hope you like this video, and if you find my series useful to the common person, then please like, comment and subscribe to my YouTube channel. Thank you.